What if the mucus in your throat isn't actually coming from your throat at all? What if you've been clearing your throat for months, maybe years, treating the wrong location entirely? That single mistake might be the reason it never goes away. Most people assume throat mucus means a throat problem, sore throat, irritation, maybe a lingering cold. So they reach for lozenges, throat sprays, warm tea, and wait for it to pass. But here's the frame shift almost nobody considers. The throat is often just the final stop, not the starting point. The real source might be sitting somewhere higher up, somewhere you can't even feel directly. That somewhere is your sinuses. Mucus doesn't just sit still up there. It drains constantly down the back of your throat in a process doctors call postnasal drip. Most of the time, you don't even notice it happening because it's supposed to happen. Your body produces about a liter of mucus a day quietly just to keep your airways moist and protected. But here's where it gets interesting. When that drainage increases or thickens, it becomes impossible to ignore. So the real question isn't why mucus exists. It's why your body suddenly decided to produce so much more of it. And that's where the layers start unfolding. Allergies are usually the first suspect, and for good reason. Pollen, dust, pet dander, mold spores. Your immune system treats them like invaders, releasing histamine, and histamine triggers extra mucus production as a defense mechanism. But here's the twist: most people miss. Allergic postnasal drip often comes without classic allergy symptoms like sneezing or itchy eyes, just mucus, just throat clearing, disguised as something else entirely. But allergies aren't the only hidden trigger. Here's what most people don't realize about sinus issues. Chronic sinusitis can exist quietly, without the dramatic pain or pressure people expect. Sometimes it's just low-grade inflammation, sitting there for months, producing thicker mucus that drains slowly and constantly. No fever, no obvious infection, just an endless throat-clearing habit that feels impossible to explain. And this is where the story takes its sharpest turn: acid reflux. Not the kind with obvious heartburn, but a quieter version doctors call laryngopharyngeal reflux or silent reflux. Stomach acid creeps upward, not far enough to burn, but just enough to irritate the throat and trigger excess mucus as a protective response. Here's the unsettling part. Many people with this type have never felt a single moment of heartburn in their life. The mucus might be the only clue your body is giving you, but the real twist is how interconnected all of this becomes. Reflux can inflame the throat. Inflammation can thicken mucus. Thickened mucus triggers more throat clearing, and constant throat clearing can irritate the throat even further, creating acid-like symptoms that aren't from reflux at all, just from the friction of clearing itself. A cycle feeding itself with no single starting point anyone can easily isolate. Dehydration plays a quieter role here too, one most people overlook completely. When your body doesn't have enough fluid, mucus doesn't disappear. It just becomes thicker, stickier, harder to clear naturally. Which means something as simple as not drinking enough water during the day can be amplifying a problem you've been blaming on something else entirely. And here's a layer almost nobody connects to throat mucus: the air around you. Dry indoor air, especially from heating or air conditioning, can dry out your nasal passages. And in response, your body sometimes overproduces mucus just to compensate for that dryness. The room you sleep in every single night might be quietly contributing to a problem you're trying to solve with medicine. Diet enters this picture too, though the science here is more debated than people assume. Dairy doesn't actually increase mucus production for most people, despite the popular belief. But here's what's interesting: it can make existing mucus feel thicker and more noticeable in the mouth and throat for some individuals, which is different from creating more of it. A subtle distinction most explanations completely skip over. Now here's where the logical buildup starts connecting everything into a single framework. Your throat is essentially a drainage point for multiple systems. Your sinuses drain into it. Your stomach can reflux into it. Your hydration level affects how thick that drainage becomes. Your environment affects how much your body overproduces in the first place. It's never just one thing. It's a convergence point where several different systems quietly meet. This is exactly why doctors don't treat throat mucus directly most of the time. They investigate upstream. Is it allergic? Is it sinus related? Is it reflux? Is it environmental? Because treating the throat alone, when the source sits somewhere else entirely, explains why so many people try lozenge after lozenge and see absolutely no change. And here's the deeper shift in thinking this reveals. Persistent mucus isn't usually a standalone problem. It's a signal, a downstream symptom pointing toward an upstream cause still operating quietly in the background. Once you start seeing it that way, the constant throat clearing stops feeling random. It starts feeling like information. your body quietly pointing towards something worth investigating properly. There's still one more layer worth mentioning, something doctors are paying closer attention to now. The connection between chronic postnasal drip and the immune system's broader inflammatory patterns, and what that might reveal about conditions far beyond the throat itself. That's a story still unfolding in the research. This script is for general education only and isn't medical advice. If throat mucus is persistent, worsening, or paired with symptoms like difficulty swallowing, unexplained weight loss, or blood, it's important to see a doctor for a proper diagnosis rather than guessing at the cause.